Before we start today's episode, I would like to quickly read you our podcast disclaimer. The content in this podcast is for general reference and educational purposes only. It is not meant to be complete or exhaustive or to be applicable to any specific individual's medical condition. No information provided in this podcast constitutes medical advice and is not an attempt to practice medicine or to provide specific medical advice, diagnosis, or treatment. This podcast does not create a physician-patient relationship and is not a substitute for professional medical advice, diagnosis, or treatment. Please do not rely on this podcast for emergency medical treatment. Remember that everyone is different, so make sure you consult your own healthcare professional before seeking any new treatment and before you alter, suspend, or initiate a new change in your routine. Welcome to The Starting Gate. We're your hosts, Dr. Kitty Dotson
and Dr. Sarah Sheets,
two internal medicine doctors who spent years practicing traditional primary care. Over time, we realized something was missing from modern healthcare. A real understanding of how everyday lifestyle choices impact overall health.
We'll help you cut through the noise of the countless health influencers and their conflicting opinions, because no matter who you follow, the basics of lifestyle medicine are at the heart of it all.
Welcome back to The Starting Gate. I'm your host, Dr. Kitty Dotson. My lovely co-host, Dr. Sarah Sheets, is not with us today, but don't worry, she will be back next time. But we are going to continue to focus on the heart again this week. We had a great conversation with Dr. Kim Williams last time, talking a lot about how nutrition can change your risk of heart attack and stroke. And he really stressed the importance of a whole food, plant-focused diet in order to minimize your risk. And today we're going to actually not talk about nutrition for once and really focus in on exercise. We have a lot that we're going to cover today. We want to talk about the different types of exercise and how those can benefit your heart, how to think about fitness as a vital sign. We also are going to touch on heart disease in women and thinking about what's happening to a woman's risk during menopause. And then we're also going to be talking about testing. What kind of testing is beneficial for you if you're looking to try to prevent disease and improve your heart function, why those tests are important, and when you should be doing them. So luckily today I have another wonderful Kentucky cardiologist with us to help guide us through this talk. We have Dr. Kelly Waespe, and she is a cardiologist at Baptist Health and was also the 2025 Central Kentucky Woman of Impact winner for the American Heart Association. And she is a cardiologist that is really focused on prevention and empowering patients to take control of their health. So thank you so much, Dr. Waespe, for being with us.
You're very welcome. Very welcome. Excited to be here.
She has another exciting thing going on in her career. She is also opening a longevity center here in our central Kentucky community that's going to be offering a lot of advanced testing like VO2 max, DEXA scans, and some other health tools like sauna therapy and cold plunge, really looking to help people try to measure and improve their metrics of health and their longevity. So we're going to get into what benefits those things have for your health and when you should be thinking about doing those when we talk today too. But first, Dr. Waespe, can you just tell us a little bit about yourself and how you even got in the field of cardiology?
So I was born and raised here in Lexington, went to high school at Sayre, med school at UK. Dr. Dotson and I happened to be in the same class once upon a time.
Great memories.
Back in the day. And did my training in internal medicine and cardiology in Mississippi. My husband and I met in medical school and we couples matched there. So spent a little time there, came back to Lexington because this is where both of our families are and home is. Got interested in cardiology. My mother is a cardiologist. She's since retired, but also just got interested in the physiology. I always liked critical care, being around the ICU, interpreting the data, looking at procedures, but cardiac physiology made the most sense to me. It was an easy choice.
Before we really get into the details of exercise and some of these other topics we're going to cover today, just thinking about all your patients and friends and family that you talk to, what do you feel like most people get wrong about prevention when it comes to heart disease?
I think people just see it as too hard. They think they can't do it. They see that they don't like vegetables or that's not their diet or that they can't exercise for one reason or another. and they just don't see themselves that way. They don't think that it's possible for them, that it's maybe for somebody else, or that maybe they think that they're too far gone or that it's too late. And I don't think that's true at all. The people that get the most benefit out of it are the people that are just starting. You can see amazing changes in their lab work and their muscle composition and their heart rate recovery when they're first starting out. So I don't think it's too hard for people or that people are too far gone. Trying to get past this idea of we have to do everything perfectly all at once and just incorporating things slowly over time. I'm going to make one small change to my diet or to my exercise regimen. And then once I feel comfortable with that, I'm going to add on to it. And then once I feel comfortable with that, I'm going to add on to the next thing. And that's really the key, is to keep adding on. But you don't have to start perfectly all at once with some crash diet or some crazy exercise plan. In fact, I see people in my office who come in who've tried to do that and tried to start a very strict diet or a very strict exercise plan all at once. And usually they end up in my office because they're not feeling right and something's going wrong.
You're saying what we love to say, which is usually small steps, and building on that is
Absolutely.
because even small things can make a difference with your heart.
A huge difference for people. And I think that's what people forget, is that you have the most to gain when you are not in shape at all, but you start little. You have so much to gain, and it's not hard to improve a little, and then that's going to start feeling easy, and then a little more, and that'll start feeling easy. This is not supposed to be a 6-week crash course. This is not supposed to be even a 6-month crash course. This is going to take a year or 2 or more to get to maybe where you want to be or where you need to be, but that's okay. The idea is not to be perfect overnight.
When do you think people should even start thinking about their cardiovascular risk and trying to make lifestyle change to improve it?
What's scary is that they've found subclinical disease at autopsy even in 20-year-olds. There's plaque growing in some people's arteries even at a very young age. So I don't think it's too early to think about it in your early adulthood. I think a lot of people start thinking about it in midlife, which again, it may be hard to reverse something that's happened for the last 20 years if you're starting in your 40s. But I think starting early sets a good foundation if you can do that. And you can also look at your family history. You can look at some of those cholesterol markers. I found a lot of young people lately who have really impressive cholesterol, and they have no idea because it's silent. It doesn't hurt them, and nobody's ever checked. So they don't know that they have that genetic predisposition to make cholesterol, or that they maybe are eating or doing the wrong things. And a lot of young folks don't even know their blood pressure. Getting things like that checked, I don't think it's ever too early.
Yeah, and I think a lot of people too, like they may go to the doctor rarely and their blood pressure's up, and then they think, well, it's just because I was at the doctor. But it might not be.
See that every day. And I encourage people, when their blood pressure is up at my office, you may be absolutely right that it's white coat hypertension, or we just took the blood pressure when you first walked in and didn't give it time to calm down, and that's not a good reading. But I still want you to go home and measure it. So go home and measure it in your own environment and get a blood pressure log for me. Then we can talk. Then we can talk about if your blood pressure is controlled or not. You're right. A one-time measurement is not the way to do it. But if you take some ownership of it and measure your blood pressure yourself at home regularly, then you'll know what it normally runs.
Let's say you're talking to a friend or family member, somebody in their late 30s, early 40s that thinks they're fine, feeling fine, doing well. What would you tell them to bring up to their primary care doctor at their annual visit, just to have a better idea of should they be thinking about this and what should they be looking at that point?
I think there's a lot of tools we can use in terms of risk calculators. So you can plug in your numbers and find out what your lifetime risk of cardiac disease is based on your cholesterol and things like that. So I think that's one useful tool that maybe they want to discuss with a primary care doctor. Another one is some of these advanced cholesterol measurements that are being done a lot more lately. Those can tell you what your future risk is as well. So, for instance, things like lipoprotein A is very genetically driven, and it's an independent risk factor for heart disease. For instance, if you have it, it's similar to having smoked, or it's similar to having diabetes in that it adds to your risk. And it's a genetic thing, and you may not know, you may not feel that it's abnormal. So, asking your primary doctor to maybe check something like that, asking your primary doctor if it would be appropriate to do a screening exam like an EKG or a coronary calcium score. It may not be appropriate for you. You may need more advanced testing, or it may not be appropriate for you for other reasons, but just asking about a few of those more advanced tests, paying attention to family history, and looking at a risk calculator. I think more knowledge is invaluable.
I agree. And you can just start the conversation by saying, I really want to be proactive about my heart health. Can we just have a conversation about what we know so far and what we might need to investigate?
And I think getting into your primary care doctor regularly is the key, because those are hard conversations to have when you're there for a sick visit or when you're there for a review of your blood pressure medications and to see if they're working appropriately. That's a hard conversation to bring up on the side. So scheduling regular exams and going to your doctor just on a routine basis, even when you're not feeling symptoms, is important, because then you can have more time for those kind of conversations.
Yeah. And your doctor has a chance to look at some trends. It can be,
For sure,
your blood pressure may be normal, but it's gone up 15 points over the last few years and you've gained weight, and all of those things can be a trend. So definitely agree. Having that regular visit and following things over time can be really helpful. So I want to get into talking about exercise. I think that
my favorite subject.
one of ours as well. But I feel like we used to just think about exercise as exercise, and then now it's gotten a lot more complicated, and especially just looking at social media, people talking about doing HIIT exercise, doing resistance training, doing zone 2, and you have to have all this perfect combination of everything. Can you just walk us through some of that? I guess first just tell us, what is exercise even doing to help our heart?
So exercise directly affects the heart, obviously, and there's a couple different ways to think of it overall. I tell people that exercise really helps the heart remodel. So a lot of people don't know that. If you think of your skin cells that are sloughing every day, your heart cells can also turn over, and exercise can induce positive remodeling. So remodeling of the heart structure and having adaptations that are happening in a positive way. So at the microscopic level, there's those cellular adaptations. There's animal studies to say that we can increase the mitochondrial content with exercise and endurance training. And if you listen to the longevity space at all, the mitochondria are the key to life. And it's what everybody talks about. So if you want to increase your mitochondrial function, exercise for sure. And it helps you better use your energy resources, oxidative enzyme activity. You're dilating your blood vessels, which actually stimulates new blood vessel growth. A lot of patients that I have don't realize we can grow new blood vessels. There's something called VEGF, endothelial growth factor, vascular endothelial growth factor, which increases your capillary density. It can actually promote the heart arteries to regrow. You can regrow new arteries around a blockage. Same thing can happen in your periphery and your capillaries in your hands, feet, legs. You can grow new blood vessels. And so exercise stimulates that growth and stimulates those growth factors. And then you get anti-inflammatory signaling with the recovery. At a big picture level, all that means is that you're going to get a stronger, more efficient heart. So with each pump, you're going to be delivering more blood flow, but your resting heart rate goes down because the pumping function is stronger. You have a bigger, better pump. You have all these long-term better behaviors in terms of increased recovery. You have better vascular health. You have, like I said, lower heart rates. You have better stamina overall. So there's the microscopic changes that then over time lead to your sort of big picture macroscopic change. And it's not just in the heart, it's also in your metabolic health, in your insulin resistance, in your risk factor optimization, in things like preventing type 2 diabetes and improving your blood pressure.
I think people just think about the heart itself when they think about exercise, but it's improving your blood flow to every other organ and basically impacts every other organ and system you have in your body. I know you love the longevity space as well. Can you tell me why Zone 2 training is such a hot topic in that?
So what is Zone 2 training? First of all, Zone 2 training is that kind of low to moderate work. You're getting your heart rate at about 60 to 70% of your maximum heart rate. I tell people I usually calculate max heart rate as 220 minus your age. So Zone 2 training happens at about 60 to 70% of that. Scientifically, what you're trying to do is keep it below the level where lactate is being used and lactate is building up in the muscle. So that is what Zone 2 is. If you have trouble calculating all that or measuring your heart rate, another way to do it is by just your rate of perceived exertion. So can you carry on a conversation during your exercise? That's Zone 2. And it's really a foundational activity. So the reason it's so big in this space and so emphasized is that it does a couple really good things. It increases your heart stroke volume. So that's the pump function, the strength of the heart. And it leads to bigger cardiac output over time. So our cardiac output is stroke volume times heart rate. You can lower the heart rate, but you can increase the pump function. So you've made it more efficient. So Zone 2 is what really does that. Endurance training also improves the diastolic function. So it's not just the squeeze. This Zone 2 can help you relax better. And there's been articles in circulation that have proven that it improves the diastolic function. And diastolic dysfunction is very prevalent in our population right now. A lot of patients don't even know that they have diastolic dysfunction, but it will show up on an ultrasound of your heart, on an echocardiogram. And that's the relaxation phase. So your heart squeezes the blood out and then it relaxes. Diastole is the relaxation. And if you have a stiffer relaxation and the heart can't relax well, then pressure builds up and backs up into your lungs, causes all sorts of problems. What Zone 2 is trying to do is improve the relaxation and improve the stroke volume. It also is nice because it doesn't overstress your joints. It's not that high impact, but it still has a lot of good cellular type signaling. And again, in the longevity space, there's a lot of these cellular signaling pathways that are talked about for longevity, like this PGC1 alpha. Zone 2 really stimulates that. And again, it's about increases in mitochondrial biogenesis at the cellular nitty-gritty level. But if that's not for you, like thinking about it at that teeny tiny cellular level, just know that it's trying to make your overall body more efficient. That's what it's really trying to do.
Do you need to do a 90-minute block of Zone 2, or is it still beneficial if you're just getting more of that Zone 2 activity broken up throughout the day?
I think it can be broken up. More is always better, but I think breaking it up is fine. The thing is about making it intentional. I usually tell people you don't want to do it at a 5-minute interval, maybe. If you've only got 20 minutes, let's say that you're on a lunch break and you don't have time to go to the gym and get sweaty. Maybe this is a good way to spend the next 20 minutes and take a small exercise bite and add it into your day. Just walk around the parking lot at work at a very brisk pace and try to get your heart rate up. That would be Zone 2, that kind of intentional training. Yeah, we need to get a lot of it to have a good foundation, but you don't have to do it all at once.
Yeah, that's a great idea to think about, because this is the type of exercise where you're not dripping sweat afterwards, where you can work it in on a lunch break, or you're at your kids' whatever sporting event, and you can just walk around the whole time and get your zone 2 training in that way. So that's a great thought, is how you can bring that in.
It's very easy to incorporate. Or you can make it a social thing. Go for a walk with your friends. Go outside. I haven't seen my friend Elizabeth in a while. Let me call her up and we'll go for a walk. And we'll kind of power walk it so we can keep our heart rate up, but still talk and walk and create some social connection around it. So yeah, zone 2 can be fun.
Yeah, I love that. Bringing in that other lifestyle medicine pillars.
Yeah, exactly. Exactly.
Tell us about how we should think about HIIT training. I feel like you hear pros and cons about HIIT all the time.
HIIT training is trying to move that maximum capacity. So if zone 2 is the more low level, steady state, moderate work where you're not getting into the lactate threshold, HIIT training is in the lactate burning stage. And what you're really trying to do is improve your body's ability to extract oxygen. And that is something called VO2 max. So each person has a different capacity to extract oxygen into their muscles. So if I'm doing a high intensity exercise and you're doing a high intensity exercise, you might have better oxygen extraction and utilization than I do, just based on your training, sometimes based on your genetics. HIIT training, high intensity interval training, is trying to directly improve that VO2 max. Yes, it's harder. It's a little bit more scary for my patients. This is what makes a lot of people nervous, really. And I definitely think that a very sedentary individual should build a good base before they jump into HIIT training. So start with your zone 2, get very comfortable for that. Maybe notice that your zone 2 has become too easy for you. And then say, okay, maybe it's time to take it up a notch. Or maybe you get with a coach or a personal trainer who can guide you through a good HIIT program. Patients with heart arrhythmias probably need to talk to their cardiologist about whether or not it's good for them to be doing HIIT training, because excessive high intensity amounts can actually cause arrhythmias. And so you got to be careful on how much you're doing. The dose here really matters. It's like a medicine. You can overdose on it. Okay. So you don't want to overdose on HIIT training, because then you're never recovering. Then your body is in this constantly high stressed state. And that's obviously bad. So HIIT training really only needs to be done a couple times a week. And studies have shown that just a couple times a week, small bites are enough to improve that mitochondrial function that we talk about in longevity. And that's enough to improve your glucose utilization or your insulin sensitivity. But in that same study, if done 5 days a week, those benefits disappeared. And in fact, it became deleterious. So you don't want to overdo HIIT training for sure. So your goal of a training program in terms of cardiovascular health should be about 20% zone 2 and about 20% HIIT and 80% zone 2. Don't overdo it.
Yes, I think that's a good message, because sometimes when you do get into exercise, and things like HIIT training can really give you a lot of good endorphins, and you can feel good from it. And so
you come out of that class at Orange Theory feeling strong. You're gonna take on the world, right?
So tell us a little bit more about, you mentioned VO2 max. Like that's something that I'm hearing everywhere now.
Yeah.
So tell us a little bit more about what someone might experience. Like if they are working to improve their VO2 max, does that mean they can go harder for longer? How does that manifest to somebody?
So it is a little bit of an endurance thing, and you fatigue less quickly because you're able to extract the oxygen better. So, your heart and lungs are delivering the oxygen to your cells, to your muscles. But how well can the muscles take that up and use it? That's what VO2 max is really trying to measure. The scientific way, or the way that I plan to measure it in my longevity space, is going to be where you actually exercise at your full capacity with a mask on, and we're measuring how much oxygen is in the air and then how much you're using, so how much you're taking in. There are different wearable devices that try to estimate this based on your heart rate recovery. Some of them are measuring your oxygen saturation, and those can be a good tool starting out. They're not always as accurate. The idea of those is to measure the trend over time. So are you improving the trend? There's some people that those wearables may not work for, though. I had a very athletic gentleman in the clinic yesterday who also happens to have AFib. And so his heart rate is very irregular, and measuring his VO2 max based on his heart rate is not going to be accurate. It's going to tell him all kinds of things and be very variable and just not really reliable. So some people might need to directly measure it. Athletes have probably experienced directly measuring it in a strength and conditioning program or something like that. But the idea is to increase that VO2 max so that daily activities also don't feel as hard. So I tell my patients in clinic who are telling me it's just hard to walk out to the barn anymore. I get out there and I have to put my hand on the side of the wall because I'm huffing and puffing. And I've done the testing for them and we've looked into it, and there's nothing wrong with their heart and lungs. It's really that their muscles cannot extract the oxygen, that they don't have the muscular capacity to extract the oxygen. So they need to build muscle, and they need to train those muscles to be able to use the oxygen better. The heart and the lungs are blamed for it sometimes, but the heart and the lungs are doing their job. They're just, those muscles are not able to use that oxygen that you're trying to give them. And that will make you short of breath.
And I think that's something that I don't remember us ever talking about in medical school or residency, but you see your patients that have led pretty active lives. They're always out doing things, but maybe they weren't exercising for intention. Yeah. And you see them decline in the later years, and it's so frustrating. But there's nothing that you can fix with heart and lungs.
Yeah, there's not a stent that's going to fix that. There's not putting oxygen cannula on them is not going to fix that. That's not where the problem is. The problem is in the muscle. And even if that patient may have been active, you and I both know that muscle mass declines slowly as we age. So the same activity that was working for them isn't enough to stimulate growth and isn't enough to keep that muscle strong and using the oxygen. So at some point you have to intentionally work at it.
Yeah, so I think that's where maybe if someone's listening and they think, I'm not trying to run a marathon or trying to be this great athlete, I guess really thinking about it as, what do you want to be doing when you're in your 80s? And you need to be acting on that now, improving your VO2 max now.
Absolutely. Yeah, and if you want to be the 80-year-old who can have no problem parking far away and walking into Rep Arena for a basketball game, then you need to be the 50-year-old who's intentionally training. You know, if that's what you want at 80, then you need to work on your VO2 max now. We know that it's going to naturally decline some. But you can get, and studies have shown this over and over, you can get 70-year-olds who have VO2 maxes that look like a 30-year-old. So you can get a 70-year-old who looks like a sedentary 30-year-old just by training. But that 70-year-old has been working hard all their life, and they at least look that much younger in terms of endurance and ability. So if we want to be there, we've got to start now.
No excuses.
Sorry.
On that topic of muscle, tell us about what resistance training is doing for our heart.
These first two that we talked about, the HIIT and Zone 2, those are your cardio type activities, really trying to focus on getting your heart rate up. Resistance training has nothing to do with getting the heart rate up, really. What it's trying to do is build muscle. That's really your main goal there. So strengthening the muscle using some sort of external load, whether that's dumbbells or bands or whatever works for you. Maybe it's just body weight exercises, but something that's pushing those muscles and stimulating them to grow. So at the cardiac side of resistance training, that's going to improve how your muscles use insulin and how your muscles use glucose. Insulin helps drive the sugar into the cell. When you build more muscle, then you're going to have more area to take up the insulin and more ability to take the glucose, the sugar, out of your bloodstream. And so then you're going to have less risk for type 2 diabetes, which then helps your heart, helps your overall metabolic health. Resistance training is also great for blood pressure control. Really, all of these are great for blood pressure control. They can't replace medication. Most of these, you get a 5 to 10 point drop in your systolic blood pressure. So if your systolic blood pressure is in the 150s, you're probably not going to get it down by exercise alone. If you're only getting 5 to 10 points, you're still above the recommended below 130, which is getting more strict in the guidelines day by day. So the muscles also give us more strength in terms of bone health and increasing bone density. If we put that load on our muscles and load on our bones, then we're going to have denser bones and less long-term risk for fractures. So not necessarily related to the heart there, but really good for overall health. And that's why resistance training has been associated with lower all-cause mortality. And that's independent of whether the person was good at endurance training, whether that person had a good VO2 max. Resistance training still lowered the all-cause mortality. Had nothing to do with how far they could run. The resistance training alone helped because, like I said, it can help you with fall risk. It can help you with preventing diabetes. So it does all these things.
So really, you can see how that would go hand in hand with HIIT training. So if you're increasing your muscle mass and then adding in some HIIT exercise throughout the week would maximize how your muscles are working for you.
Exactly. And it is good to incorporate both. So like my personal plan or what I do on a day-to-day basis, I do mostly strength training. And then at the end of my strength training, depending on how much time I have and how long I've gone and the day and all that kind of stuff, I will do either zone 2 or my intense cardio, like my interval training at the end. And this morning, 30 minutes of strength training, then I did my interval training.
What do you like to do for your interval training?
So I vary it up. Right now, I'm on this Norwegian 4x4 training, which is supposed to really increase VO2 max. And what that is, 4 minutes of high intensity, followed by 4 minutes of rest, and you repeat it 4 times. I do that on various things. So like I've done those intervals on the elliptical before. I've done those intervals on the rower. I love a good rowing machine. And I've done those intervals on the bike. I vary it up depending on how my muscles are feeling. I didn't use the rower today because I had just done upper body and my shoulders were bothering me a little bit. So I actually just did it on the treadmill. That interval training can be on any sort of equipment or apparatus. It doesn't have to be running. I think a lot of people in their head think of it as running. It does not have to be running. And in fact, if you go to a cardiac rehab program, they're going to have you do the hand crank machines and do some upper body exercises too. There's ways to get your heart rate up without running.
I like that way of thinking about it, the 4 minutes on, 4 minutes off and doing that 4 times because you could do that with almost anything.
And it doesn't seem that hard when I think about it because the 4 minutes on, the first set, not that big of a deal. Second set, getting a little hard. The third and fourth interval is a little bit difficult. Yeah, I don't like those. But you've got 4 minutes to rest. And so I'm always telling myself there, I've got 4 minutes to rest on the other side of it. And the idea of that physiologically is allowing enough time for the heart rate to recover to that sublactate threshold. So you're getting your heart rate down, you're getting a good recovery in between, and then you're at it again. So yeah, I watch my heart rate on my watch quite a bit. And I try to make sure that before I go into the next interval that my heart rate's good and recovered. For me, that's a heart rate of about 120.
And speaking of recovery, is there anything people need to be thinking about? Do we need recovery days for our heart or things where we're not pushing it?
Absolutely. You can way overdo these things. If you overdo resistance training, for instance, you're going to set yourself up for muscle injury. That's just a given. Physical therapist after physical therapist will tell you about their patients that have overdone it in training. Yeah. And then also in the endurance space, you really have to be careful of overdoing it because you want to clear out that lactate. You want to give your body time to recover. Also, when you're talking about HIIT training, there is a cortisol spike, which I think scares some people.
That is what I think I see all over social media that scares people from doing it. Yeah. Can you talk on that for a minute?
Yes, it is true that HIIT training will spike your cortisol. And one of the reasons that you don't want to do it every day is you don't want to spike your cortisol all the time. You want to give plenty of time for that, for your body to adequately recover from that. But this is an idea called hormetic stress, meaning a controlled stress in a controlled manner that the body then learns to recover from. Yes, it's bad to have cortisol levels high all the time from life stressors, from things that are out of our control, from poor sleep habits, from anxiety or whatnot. But stressing the cortisol system in a way that's in a controlled manner can actually help it learn to lower your cortisol. It's a feedback mechanism that helps it lower it overall. So, when you do HIIT training, your cortisol levels are going to rise within about 15 to 20 minutes, but they don't stay high forever. The reason it does that is you need fuel, okay? And so the cortisol spike is telling your liver to push out sugar so that you have more fuel for this high intensity work. So it's a natural phenomenon. It's not a bad thing. And there's no evidence to support that people should avoid HIIT training just because of these. Even in diabetics, that push, that glucose surge is going to be short-lived and is going to teach the body to recover and utilize insulin better. So the overall benefit is still way outweighs any risk. Again, we're pushing into the fat burning side of things to the lipolysis when we get into HIIT training. And you can't do that with just resistance training alone. You're, again, increasing that mitochondrial function in the PGC1 alpha pathway. There's so much benefit to it that really this benefit way outweighs any cortisol spike. Another big thing I think about in the HIIT training is it's going to really improve your heart rate variability, which I think a lot of people are learning about and is talked about a lot lately.
Yes. I'm glad you brought that up because I do think that's something that we're seeing a lot more, heart rate variability, and you might see it as HRV somewhere. Mm-hmm. Tell us a little bit more about what that means.
So that is the beat-to-beat variability in your heart rate. So if you looked at an EKG with each tall spike, there's going to be a few milliseconds between them difference. So let's say your heart rate is 60. From one beat to the next beat might be 59.99. Then the next one might be 60.01. Then the next one might be 59.89. And it's going to have a little wobble room even if your heart rate is at 60. So your heart rate is not necessarily dead on 60 all the time. Why the wobble room? That has to do with what the sensory input is and the drivers are for your heart rate. So our nervous system is overall what we call the temperature control. Think of it as your thermostat. So you've got two sides to the nervous system, the parasympathetic and the sympathetic. Sympathetic is going to be your fight or flight. If a bear is chasing me in the woods, the sympathetic is going to come out and I'm going to get a big adrenaline rush and run screaming. If the parasympathetic is called the rest and digest. So, no more bear. I can relax. I can go eat. I can do all my things. I can go have a nice spa day. So the balance of the two is what is shown up in your HRV. You want the two to be in good balance, and you want to have a little bit more of that recovery side. And when you have more of that recovery side, that more of that parasympathetic and relaxation time, then there's a little bit more wobble room in that heart rate. And that's because your heart rate tends to be lower. So if you run a heart rate of, let's say, 100 all the time, the wobble room, the heart rate variability is going to be not as good. You want more wobble room and you want a slower heart rate. So you want a higher HRV. So a higher HRV tells you that you've got a lot of good recovery, a lot of good parasympathetic input. So HIIT training, coming back to that, can increase your HRV. It's because your heart rate gets high, but you're also having the intervals where you're letting it calm down. And it's training your heart rate to go back and forth over time to sympathetic, then parasympathetic, the interval, and then the relax, the sprint, and then the recovery. And so the HIIT training really is designed to do that, designed to mimic that. If you really want to train your HRV and get it better, HIIT training is a great way. Like I said, don't do it every day. You'll hurt yourself, and then your HRV will suffer because you're not getting enough recovery overall.
And so if someone was wanting to start some of these things, let's say they've just always been a walker and they want to start incorporating some HIIT, incorporating some resistance training, how long would it take for them to see a difference in HRV or see some improvements in the heart function?
So almost immediately, you can get some benefits. There's studies that show that even within a week, you'll get improved oxygen delivery. So you may not be able to measure it quite precisely on a VO2 max, but it's there at the cellular level. You're getting great adaptations almost immediately. In 2 to 4 weeks of kind of steady training of doing zone 2, then you're going to start noticing that your submaximal capacity has gone up. So then that's when you're going to say, I can do more and talk better while I'm walking with my friend. That's going to take a couple weeks to really show up, but it's still beneficial even immediately. Studies on that have shown that your lactate's clearing even better at that 2 to 4 week level. So you're getting cellular adaptations immediately, but at the 2 to 4 week level, you're starting to really get some of the improvements. Now, if you want to see VO2 max change, that takes more like 6 to 12 weeks, which is important to say. That's why you need to stick with it because we know these markers, we've got to move the bigger needles. We don't just want the adaptations at the cellular level. We want them to turn into the sustained change. You're going to get benefit right away, but don't those small benefits turn into bigger gains the longer you stick with it.
So if someone really is ready to focus on this and make a big change and they came and did a VO2 max assessment with you, how often do you recommend people would then repeat that to see the change?
I would say quarterly, maybe every couple months, because if you do it too soon, you're not going to be able to really see the difference of your training program. You're still getting those benefits at the microscopic level, but at the macroscopic level, you're not going to know if your VO2 max has really changed yet. You don't want to do it every week. It doesn't quite work like that. You want to do it over several months. Give yourself some time to really build up. And that's similar with a lot of programs in resistance training. It takes several weeks to build muscle mass. It's going to take several weeks to see that benefit too.
Yeah, which is also why you should not just go by the numbers, but really just make sure that you're noticing how you feel.
100%. Exactly. And there are even athletes, for instance, in their strength and conditioning programs, they will incorporate maybe a week of rest because they've really got to give themselves some good recovery. And if there's going to be some days where we have to push through it and we have to do it because even when we don't feel like it, but if you're going hard at it every day and you're noticing that you're more and more fatigued and that your muscles are really sore, you're probably overdoing it. And maybe it's time for a week break and really focusing on your nutrition and hydration at that point and just caring for your body in other ways.
Yeah, definitely don't forget hydration as you're doing all
As
this.
I sit here with my big, large drink. Yes.
That was a great detailed discussion on what exercise is doing. I want to get into another topic, which I know you're passionate about, which is women's heart health. And I think we forget as women a lot of times that heart disease is still the number one cause of death for women. And I feel like women just don't think about that at all until way down the road when we've missed the boat from the prevention side of things. So thinking about a woman who's maybe in her 40s, who's maybe entering perimenopause, what is starting to go on with her heart and how do things change as she goes through menopause and gets older?
Good question. We know that the hormones are shifting quite a bit, and that's going to lead to different metabolic shifts. That's also going to lead to different shifts in your muscle health and things like that. So it can also lead to changes in your cholesterol, which a lot of people don't realize. So if you're not checking these things, now is definitely the time to start. I think a lot of people forget that weight distribution changes, or we notice it, but we don't realize until it hits us all at once in that perimenopause trait. But that's one of the biggest, I think, outward changes that we can see in women is that we get more of that visceral adiposity, which is that central stomach weight. And that has been really linked to long-term bad heart health. That's a direct correlation with heart disease. Another one with menopause and that time and the hormone shifts is women start seeing disruptions in their sleep. I think paying attention to their sleep even earlier than menopause is key, because if it's not good going into menopause, then it may not get any better with the hot flashes and things going on. And a lot of people don't realize that sleep apnea is actually one of the leading causes of high blood pressure. It's a big secondary cause of high blood pressure. Getting that checked, getting that under control beforehand, I think is huge. As women, we tend to focus on everybody else around us. The American Heart Association had a funny video with Catherine Bates, I think it was, who's a comedian, and she's having a heart attack in her kitchen, but she's taking care of everybody else. She's getting lunch bags for the kids to get ready to go to school, and she's getting coffee for her husband, and she's finding his keys, and she's doing all of these things, and she's dressed in a suit and obviously ready to go to work. And she just keeps putting her hand to her chest and like having a little indigestion, and she's doing everything for everybody else, and nobody notices what's going on. And then everybody leaves the room and she falls over from a heart attack. And that is the middle-aged woman, I feel like, that we tend to mother everybody around us and forget about ourselves. And so I think it's really key for women to start thinking about their own health even before menopause, so that when their body is showing signs of hormonal shifts and all of these metabolic shifts, then they already have a strong foundation going into that. And they've already gotten in a good rhythm of taking care of themselves.
That is a great illustration of that. And even though that seems a little bit extreme of someone having a heart attack while they're making lunches for their kids, it's really what a lot of women are doing or setting themselves up to do maybe 20 years later.
100%.
When you're not taking care of yourself in your 40s, then that's when that plaque is building up in your arteries.
And a lot of women see it as a man's disease. And so they think it's not going to happen to me. I think there's a little bit of that out there. And women are more prone to some of the sudden cardiac disorders like SCAD, the sudden coronary artery dissections, which can happen, especially postpartum. And women are more prone to things like Takotsubo cardiomyopathy, which is a stress-induced heart attack. So I think we don't think about it, but our risk is really there. And it is unique in women. It really is. There's a lot of things that women are more prone to that men are not. And if we're not thinking about it, if you're not thinking about it and measuring it, you can never improve it.
Yeah. I think just taking the time to stop and think about it, think about your risk, and think about what you are doing for yourself to help, whether that's exercise, whether that's optimizing your sleep, eating well. Sometimes being busy, especially if you're working or you're a mom or you just have a lot on your plate for whatever reason, it can become an excuse to not put the effort in to do it.
100%.
But it's much easier to prevent a heart attack than it is to try to reverse things after it happened.
Dr. Kim Williams said it last week that 80% of heart disease can be prevented through lifestyle interventions. So 80%.
It really is shocking when you think about that.
It's huge.
Think about
that's why we're here, trying to get the word,
billions of dollars,
trying to get the word out, because it really is. If we don't think about it now, it's going to bite us one day. Yep. And there are some genetic things that are totally out of our control, but there's a lot of it that's in our control, 80% of it.
Yes. So make sure you're at least stopping to think about it and think about what is something little you can do today to try to reduce your risk down the road. Another thing I wanted to ask you about in relationship to women is there's a lot of talk, of course, about menopause lately and hormone replacement therapy, and the pendulum has swung back and forth on if hormones are safe for the heart, are they beneficial? Can you give a little bit of knowledge about the timing of hormone therapy and how that impacts risk of heart attack for women?
You and I have experienced this in our careers, right? It definitely has swung in our careers of don't do hormone replacement therapy to now it's considered safe and effective and potentially beneficial for a lot of women. So overall, we know estrogen decreases in menopause. That's the big thing that's driving a lot of the changes and a lot of the symptoms. Estrogen normally helps dilate blood vessels. It normally helps blood vessels flow, the endothelium of the blood vessels. It enhances their function. It normally reduces oxidative stress. After menopause, without some of that, we get a reduction in all those factors, which is bad. So estrogen was helping us, and now we've taken it away. So arteries become stiffer after menopause. Arteries don't dilate as well. We don't get as good of blood flow, and the plaques are going to form faster. So again, one reason we need to be thinking about it before menopause is that after menopause, that risk is going to accelerate. Like I said before, loss of estrogen will also contribute to changes in your lipid profiles. You get less LDL, less bad cholesterol uptake in the liver, and we want the liver to uptake it and get rid of it. But because you don't have estrogen anymore, the liver's not doing that. So we also aren't having as much of that good cholesterol pumped out by the liver. Your cholesterol's out of whack. Now your arteries are out of whack. It's just a setup for getting heart disease. I think one of the things that has come out in recent years is, okay, so should we try to give some estrogen to reverse this? And is estrogen helpful? Is estrogen harmful? We do know that there are some potential side effects to estrogen, things like clotting risk. Women who take birth control have a slightly increased risk of deep vein thrombosis, of DVTs. So we want to make sure that we're giving estrogen to the right patient, to the patient who is at the proper time, just entering that menopause, but also not too late where their risk of heart attack is higher. We don't want to give estrogen to a patient who's maybe 10 or 15 years past menopause, and now those plaques have had time to grow, and now you're giving estrogen that can promote clots on top of plaques. Not a good scenario. Let's not do that. So there's been a lot of debate back and forth about this and trying to find the optimal timing of estrogen replacement, of hormone replacement. And I think the guidelines are trending towards this timing window of the first 10 years of menopause or doing it before the age of 60 to really find that optimal risk-benefit ratio that we talk about in medicine so often. So when is that risk-benefit there? It's usually below 60 and in the earlier stages of menopause. But don't let that scare you into not taking it. So I've told you some of the bad things that can happen, but we have also seen that at that early stage, we are more responsive to the good portions of estrogen and good portions of hormone replacement therapy. And so there's been trials that showed that estradiol, an estrogen derivative, slowed plaque buildup in the carotid arteries and the carotid intima media thickening, and then helped it from later not progressing to a major plaque. I think the timing is key. The patient selection is key. It's definitely a conversation to have with your doctor. It's not something to be an all or nothing about. It's something where you're going to have to weigh the risks and benefits and figure out if it's right for you. If used at the right time, it can be beneficial.
I love that you said it's a conversation with your doctor, because I think that's just a great way to think about it. Sometimes what you see on social media and things really makes it seem black and white, like you should absolutely take hormones if you're a few years out of menopause, or you absolutely shouldn't if you're this far, or you see someone else's story and you assume that applies to you. But you really want to make sure, if you are a woman that's thinking about hormones or already on hormones and thinking about whether you should stay on them, you want to make sure you are seeing someone that can think about it from all the angles,
Yes.
understands that estrogen can be beneficial to the blood vessels, but past a certain point can maybe make the risk of heart attack worse. So make sure you are talking with someone about your personal risks and not just jumping on a bandwagon.
As a cardiologist, I get that patient come in for that conversation with me a lot of times, and I'm happy to have it. Talk with your primary care, talk with your OBGYN, talk with your cardiologist, get multiple opinions on it and figure out what's right for you. Medicine needs to be an individualized care, and what's right for one patient may not be right for another.
Good to know that you can come see Dr.
You
Waespe
can come see
when you're
me.
thinking about
Come
this.
find me when you're thinking about it. Yeah, I have that. I had that conversation earlier this week.
So tell us how a patient could come see you in clinic. And then I really want to talk more about this Revive Longevity Center that you're opening up.
Yeah, so I'm with Baptist Health in my day job. I am at the Hamburg location, and I'm in Paris and Winchester. I have some lovely, wonderful nurse practitioners who work with me, who I have personally trained to think like me and do preventive cardiology. So we're there multiple days a week. Usually the best way to find us is to go through the Baptist Health website. I do not require a referral if somebody wants to come see me. And I see people without heart disease all the time for a screening evaluation. What kind of screening tools would I recommend for them? Or like I said, I just saw a lady this week considering hormone replacement therapy, and she wanted to get multiple different opinions on it before starting. I would love to have people who are interested in their health, and I love to talk with patients and educate patients. It's a good and a bad. I'm often behind in clinic, but I'm often behind because I've spent a lot of time talking to people and trying to educate people and just really having that conversation. So that's something that I love to do. So hopefully people will come and we can sit and chat and talk about exercise and talk about hormones or whatever kind of stuff they want to or need to.
I know that you love educating your patients, and I think that's really why you thought about opening this new facility.
Exactly. So, I think that there are so many patients. I've had this VO2 max conversation with patient after patient over the years, and it really did just come to my mind. What if there was a way to show people what I'm talking about or what I'm trying to explain to them? Sometimes a visual or a physical representation is worth 1,000 words, and I may not be getting through to them. So that's one of the things that really spawned my idea for Revive Longevity, was thinking about VO2 max and how I would like to know my own. And then I searched around for testing options, and I searched around for my own DEXA scan and found out that it's hard to get some of those things in one place. There are options out there through the University of Kentucky, for instance. They have graduate students that are doing VO2 max testing, but then I had to, where am I going? Where am I parking? And they were doing it more for research, so they were not as much about being open to the public as they were about gathering knowledge for their research and that kind of thing. So I wanted to do something that was a little bit more accessible to people so that everyday people could have good, accurate knowledge of these kind of things. Some of the things we're going to be testing, I've talked about a DEXA scanner a couple times now. The DEXA scanner is a way to tell your body composition that is scientifically and used in research as one of the more accurate ways. What it's doing, it's telling you the amount of muscle mass to the amount of fat mass that you have. And specifically, it can get that visceral adiposity tissue, that central obesity, that stuff that hangs out around our stomach and those love handles. It can get those very accurately, so that people know. And let's say that you went on a journey with resistance training and were working out with a personal trainer and you wanted to know, am I gaining muscle? If you had a DEXA scan before and a DEXA scan after, you could compare those two results and see the changes. I think a lot of patients get really frustrated getting in the gym and I haven't lost a single pound. You asked me a very appropriate question earlier. When will the changes happen? The changes happen immediately, but you're not going to see them for a while. And you may not see them on the scale for a long while.
Yeah, I feel like it's the last thing to change.
Exactly. But there are other things that we can measure ahead of time before that scale is even moving, to show you that you're doing yourself a huge favor. So if we measure these things, I think also it can be encouraging to people to say, oh, okay, I am doing something. Even though the number on the scale isn't getting better, I'm doing myself a huge favor because my muscle mass went up. I'm doing myself a huge favor because my VO2 max went up. Another longevity metric that we have that we're going to measure is strength training, specifically grip strength. And we've got a dynamometer which can measure grip strength, but we can also use it to measure other extremities and strength in different ways. Grip strength, if you're doing resistance training, you may just improve only in grip strength. You might not improve in the load that you can carry. I might not be able to progress from 20 pounds on my bicep curls to 25, but my grip strength might be going up, and that's still huge for my longevity. So I think having some of that knowledge and testing some of that is encouraging to people. It can help direct their program in the right ways. So let's say that your grip strength is off the chart, but your VO2 max is really low. You need to be working on the endurance training or the HIIT training. You need to be focusing on other areas. So I think giving people a guide in that sense is really my goal, giving people the knowledge, because if you don't measure it, you can never move the needle, ever. There's been I think there's a business mantra, you can't manage what you don't measure. Yeah. So if you don't measure it, how are you going to know? If you want to improve these things, you got to know where you stand and then improve them. And then the recovery side of the business is things, sauna amazingly has some actual data out there, good scientific data that it improves longevity. You have to use it quite a bit, 4 times a week, minimum about 20 minutes. But in the Finnish heart study, that actually improved cardiovascular mortality by quite a bit. The cold plunge, I like to think of as a way to improve your HRV. So it can really work on your parasympathetic side. If you think about that diver's reflex, when you get in cold water, your heart rate lowers. And so it contrasts with the sauna and makes it, a lot of people do one then the other, a couple minutes of one, a couple minutes of the other, go back and forth. But the goal of the cold plunge is to stimulate that HRV and stimulate that parasympathetic nervous system side. so that you can improve your heart rate and recovery in other ways. It actually, athletes sitting in an ice bath, it improves your muscle recovery and how long it takes them to recover after a workout. So lots of good information there, things to help you optimize your health. Other things that we're going to offer are things like expanded lab results and genetic testing for different health metrics. So there's a lot of really cool genetics out there that can tell you, for instance, that you are built to be more of a strength trainer rather than an endurance trainer. When I learned that about myself, I was like, oh, I don't have to run a marathon. I thought since I was a cardiologist, I needed to be running marathons by the time I was 40. Turns out that's not how God made me. And my genetics freed me up to say, I can still work on my HIIT training and still work on my endurance. Strength is going to be my wheelhouse. And that was good to know. There's lots of cool things like that genetics can tell you. Sleep habits, it can tell you about your metabolism in terms of whether or not you metabolize carbohydrates or fats better, all sorts of things. Yeah, just different things for people to learn about themselves and help them improve and move the needle.
Oh, that's exciting.
Yeah.
And actually, you set us up perfectly because next episode, we are going to talk more about precision medicine and this kind of testing and how it might help you on your journey. That's exciting to know that this will be a place that people can go
come out. Yes,
for
absolutely.
that. So when and where can people potentially find Revive?
So we are opening in April, coming up soon here, rapidly approaching. We're located at 3174 Custer Drive off Pimlico Parkway, and our website is revivedlongevitykcenter.com. Website's not live just yet, but we'll be in a week or two, and we're going to hopefully have pre-booking. Also, Revive Longevity, I'm on Instagram. We have a Facebook page, so you can follow us there for updates about opening. Another plan to have some different speakers and educational events around the opening and hopefully ongoing. So yeah, follow us on social media is probably the best idea right now. And then pretty soon we'll have revivelongevitycenter.com up and running and you can pre-book.
Awesome. Well, we'll make sure to have links to all of that in our show notes and follow along so you can be ready when it opens and take advantage of these things. Well, Dr. Waespe, this has been a wonderful episode. I feel like you've really given us so much help about thinking through exercise, thinking through why we need these different types of exercise. Zone 2 to improve our efficiency of the heart, the pump and HIIT to help maximize the function and improve the efficiency of extracting oxygen, and then resistance training to improve the muscle mass, which can help with all of the other things that we just mentioned. And also the importance of recovery, which I don't think we talk about enough.
We don't talk about enough, absolutely.
So I think you've explained all of these testings that we're seeing in the social media space, and now we have somewhere here very soon that we can come in Central Kentucky to actually get these and figure out where we are for ourselves and make a plan. So just remember, it's never too early to start thinking about your heart health and thinking about prevention of cardiovascular disease. And so we ask you to just think about one thing you can do today to start improving your heart, and look forward to seeing you next time.